to say by way of introduction that I think this is a great initiative, Lindsay. I think it's the first one of its type that I've ever been asked to attend, and that's one of the reasons why I was really glad to host it at UCL. Although Maze is sceptical, we have just been through a 3-year building programme, and we do have a state-of-the-art building, but not quite in this bit. And so I apologise for the fact that even though we moved in a year ago, the AV in this room hasn't been sorted out, and that's why we're stuck with this little TV screen. And whereas I did my slides for a very large screen, now they're quite a small screen. So some of it might not be as easy to read as it ought to be. But anyway, and the other thing I should mention about slides is that mine aren't in the pack, because I've been useless. But I think that we'll hope that we can get them circulated this afternoon. So if there's anything that you're dying to scribble down, you don't need to. You can do it later on this afternoon. So what I've been asked to sort of start this out with the academic view, and I'm not really sure what that is, so I'm going to give you a personal view. As many of you will know, I've been researching in the field of legal services for a very, very, very long time. And during that time, I have been acutely aware of the deficiencies in the availability of data on legal services, on the justice system. We make policy, we design services, we deliver services very often in what I regard as an information black hole. It's been like that for a very long time. I have a lot of personal stories about working with advice service people in the NFP service providers, where I have been desperate about the need for me to collect data to do the kind of research that I wanted to do, and have been desperate about how weak the data collection processes are, because people have always, and I understand this, people have been focused on delivering the service. But we are in a different world. We are in the post-LASCO world. And if it was important before for legal services to demonstrate, not just to know what they're doing is a good thing, but to demonstrate the benefit of what they did. If it was important before, in the world we are in now, it is absolutely critical. It's a critical issue in terms of people wanting to do more than just advocating, proclaiming the benefit of what they do, but if they want to convince people about the benefit of the service that we provide. I've recently seen some draft papers, one from the World Bank, which is trying to work on the benefit, how to assess the benefits of legal assistance, how to assess the benefits of legal aid. And of course, one of the things they identify is the absence of consistent, robust data about both what it does and both what the absence of legal advice, what the cost of absence of legal advice is. So this is absolutely clear. The Australian Productivity Commission also interested in these kinds of areas. So we all know, or we all should know, that there is a lack of good evidence in fields. Not that there's no lack of kind of information and sort of forms of data, but there's a lack of really good, robust evidence in the field of legal service provision as to the benefit that is provided and the cost of not providing that advice. What happens when you don't give that advice? I've been even more aware of the deficiencies because I've recently been working in the field of health justice, and I've been collaborating with some public health researchers, social epidemiologists, there's some here today, and looking and reading a lot of the work on evaluations of interventions in the health services field. I was even more aware of the shortcomings of our attempts at evaluation, of what we call evaluation in the legal services field. So I think we are deficient in terms of our evidence base. We don't have a good solid evidence base. We're not good about data collection, and we're rather simple in some of our research methods. An example in that field, the Low Commission in 2015 reviewed all of the research that had been done looking at the value of legal advice, or the impact of legal advice on health. And there was no shortage of studies, but what they concluded is that you don't have there any kind of rigorous, robust evidence base. They have a lot of qualitative research, a lot of simple service evaluation which doesn't amount to the kind of evidence that convinces funders or anybody else. So we have a lack of a rigorous approach to evaluation and to the impact of establishing the impact of legal advice. So that's my kind of starting point. And if I'm offending anybody who thinks that they are tremendously rigorous and I'm normal with this, then I will be interested in reading later in the day where that all is. So what I want to do is just say something about why we need to measure outcomes, what it is that we need to measure, and how we go about it. And this is all very high-level stuff, because I don't have the answers to some of the really complex problems that Mavis mentioned, but we need to be addressing it. It's not good enough to say, oh, it's really hard to measure outcomes. Do it. We'll do it in many other fields. We have to think about how to go about doing it. And what I'm trying to set out here is the way that we should be approaching measuring outcomes. So why do we need to measure outcomes? Everybody knows, well, to measure the quality of the service that you're providing. And that's not just saying, do people like it and do they appreciate it, but what is the service? What do you think the service is that you're providing? And is the way that you provide it actually a good way? Is it the best way? Are there other ways of doing it? Is it effective? Does it actually do what it's supposed to be doing? Is it efficient in terms of how you use your resources? Does it help you to make decisions about how you allocate resources? And does it help us ultimately in fundraising? We are in, the advice sector is in a very, very difficult situation. We're all desperate to get sources of funding. We're competing with each other. We're competing with everybody else for such resources are available. How do we demonstrate? We need to be able to demonstrate the value of what we do. We need to be able to make the case for funding. The problem that I said at the beginning is that actually law and legal services are not and never have been an evidence-based, they're not evidence-based either disciplines or services. I'm showing you this because it makes me laugh. In the health field, the gold standard for evidence, of course, is the random control trial. It's not the only way, but that is the gold standard. We don't have, in the legal services field, we don't have anything approaching that. And there was this funny article that I saw in 1999 where we were talking about the alternatives to evidence-based. How, when you don't have an evidence base in medicine, how do you make clinical decisions? So you use eminence, the radiance of white hair, I love that one, eloquence, smoothness of tongue, vehemence, I think that, it is still on there, level of stridency, and confidence, which apparently only applies to surgeons. No sweat test. I love this. I've been trying to use it for ages. And interestingly, in this article, what they're saying is that the trend towards evidence-based evidence-based medicine is so great, or evidence-based service provision is so great, they say that soon even the lawyers will be using evidence-based practice. And that was in 1999, so they recognised the absence of an evidence base for law. So it's a joke, but I think that the evidence-based movement has had a transformative effect on research in many different disciplines, healthcare, education, management, and so on, policy. In contrast, law and legal services lag behind, and I think law in many respects is still either eloquence, vehemence, or eminence-based. You know, I've had lots of people tell me very vehemently that what they do is absolutely fantastically beneficial. I said, well, yeah, it sounds good, but where's the evidence? And so I think that we've got a lot to learn from healthcare. What is it that research in the health services field, the public health field, can help us with? First of all, how to measure impact and quality. That more rigorous, robust approach to the measurement of impact and quality. How to anticipate and respond to trends using data. If you've got data, there's so much that you can do. We don't have the, it isn't that we don't have the data. All of the services have got data in a million different ways, muddled and messy and not accessible. And that will be my ultimate message at the end. And also it helps us to think about how to invest in legal interventions that can help us to focus on prevention, help us to understand which of the interventions that actually are the most effective. So I want to say something quickly about the difference between outputs and outcomes, because I think a lot of the work that goes on in the legal services field is about measuring outputs, focusing on what is it we do, what do we actually do, but that's process, it's not outcome. So an example here of what you could say is what we want to do is provide a high quality legal advice and representation to low income people. That's what we want to do, and we measure, that's what we do it. That is not measuring an outcome, that's a measurement of what we actually do, what we spend our time doing. Make sure that nobody is deprived of access to legal assistance. Again, that's a process, it isn't an outcome. Outcomes are different. Outcomes, and these are examples of what, and I'm sorry if you can't read them very well, but these are examples of how you could specify the outcome of what you're doing. So this is the process of what I do. What do I expect that will achieve in terms of benefit for the individual, for the wider society? So resolving problems to promote economic and family stability, to reduce poverty through assistance. I mean, it's just a couple of examples. Make sure that laws affecting low-income people are actually enforced, empower individuals, make people more capable of dealing with their problems. These are the kinds of things that are outcomes rather than simply measures of what we're actually doing, whether people like our service. So if we're going to be in the business of measuring outcomes, what do we need to do? We need better specification. We need to think harder about what it is that we're actually trying to do, what we're trying to achieve, and how we would go about measuring it. So specify the service, to be clear about what is the service that we're providing, what is the purpose of that service, what does it mean to be working well, so what does success look like, for whom, which groups of people, and what is actually measurable. And then, the other thing that we don't do enough of, we really don't do, is to think about the counterfactual. Better than what? So good. What would happen without the service? Or what would happen with a different kind of service? And very importantly, in terms of policy, what are the costs of adverse outcomes that have been avoided? Because a lot of what we do is avoiding worse. Something bad has happened, we're trying to avoid something worse from happening. We don't even begin to think about how to measure that. And so what we need to do is to develop what is called, and I'm not suggesting I'm a specialist in this because I'm not, but it's something that strikes me as being absolutely the right way to go about it, is to develop evaluative thinking. So we don't just think, oh, we better do an evaluation because the funding is coming up. It's to embed a culture of evaluative thinking in our systems. So the difference between evaluation and evaluative thinking is that evaluation is the sort of thing that you do from time to time to help you make some judgments or make decisions. But evaluative thinking is a reflective practice. It's questioning, reflecting, learning and modifying. And I think the thing that strikes me about it is the constant state of mind. It's not, this is the service, this is what we do, we know it's good and fine, we're going to go on doing it. This is the service that we provide. We think it does this, but actually we need to check whether it does. Could we do it better? Could we do it differently? Could we have a different outcome? And it's going through a kind of cycle. And I've nicked this from Susie Forrell, who was the Law and Justice Foundation in Australia. This is an example, I sort of adapted, she did something like this and I've adapted it because I think this makes a little bit more sense. So if you're doing evaluative thinking if you're embedding evaluative thinking in the culture of your service, you start with what is the need, you identify the need, what is the need that we're trying to meet, you plan by means of articulating the intended outcomes, and for this is very much, I always say this is a health thing, but actually it's just a kind of a policy, a systematic policy approach, which is your theory of change. If you think you're producing that benefit, what is your theory of change? What is it that you understand or what you believe about what your service does that delivers that outcome? And that helps you to think through how to design the service and then how to measure the outcome. Then operate, collect service data. Collect service data. But collect service data in a way that is usable, and I'm going to get to this at the end, and that is consistent, and follow up the outcomes. I'm astonished at the amount of stuff that goes into collecting data about process, but not even simple things about outcomes. So what actually happens in the end? When I say, so what happened at the end of this case? I don't know, actually. I know what we did, but I don't know what happened at the end. And then you can evaluate, and then you can review, you can share, you can modify, improve. So that's the kind of approach to what I would call a systematic approach to evaluation, embedding it in the culture. I think there are massive opportunities now. So I think that we've missed the boat in many respects in the past, the pre-NASPO thing. We didn't have this evidence at the time, not really. But there is a real opportunity now with things going more digital, with people beginning to use management systems, making more use of management systems, of people using apps, of the online courts and tribunals. That's both a challenge, but there's a real opportunity in terms of data, of actually getting together data and harvesting that data to understand the nature of needs, the nature of legal needs, the problems that people have, and something about outcomes. So we need to, this is timely because we need to be preparing now. I think it's time, it's not too late yet, so maybe, to think about the opportunities and the advantages. Oh, sorry, I'm on the wrong slide. Well, I was just running on here. So that was, I was talking about technological changes. And what we need to do, so this is my plea, I'm ending with my plea, which comes from the years of experience in this field. We need a national effort on this, so I think this is a first start, that we need, I think that there is a problem with the kind of historic competition between providers. We need to get together on this because it is in all of our interests to provide this evidence base. So we need a national effort, we need collaboration on data collection. You're doing the work, people come to you, you're giving them the service, you know what the outcomes are, you are in a position to collect those data. When an individual researcher comes along and has to start doing it themselves, it's really difficult. You've got the data, and nowadays you've got it much more computerized, I hope. It's not all kind of scribbled down on the backs of post-its. So we want a national effort, we need collaboration, and we need consistency. We need to agree on what are the things that we're capable of measuring and that we want to measure, at least the minimum that we need, so that we are developing this marvellous database on outcomes that will support us in the future for making the case for the resource that we need to keep legal services going. And don't say GDPR to me, because I just did an online course on GDPR, so I know everything about it. And I had to do it, I was required to get sacked. And GDPR is not a bar. You have to be careful, you have to think about it, but it doesn't stop us from doing it. Collecting the data, consenting people, and then using the data, getting together to use the data. So that's my plea. Thank you very much.